Afternoon, everybody. This is the fortnightly public update meeting on the coronavirus situation and how various partners are responding to it. So today we have Richard Flinton, who's the Chief Executive of North Yorkshire County Council and Chair of the North Yorkshire Local Resilience Forum. We have Dr. Lincoln Sargent, who is Director of Public Health for North Yorkshire. And we have Chief Constable Lisa Winwood and Assistant Chief Constable Mike Walker here today to talk through things. We have had some questions from the public in advance of this. So what I think I do is just run through those questions so that when people do their updates, they can cover off the answers to those. So the first question we've had is for Lincoln. And that is whether there is a role for volunteers in the trace element of test and trace, because there are lots of people who have volunteered in a variety of roles during the pandemic, and people want to remain engaged and involved. So that's one question, which came from Councillor Philip Wicks of Richmondshire District Council. Excuse me. The second question we've had is about the statistics for the prevalence of the virus and how granular that gets. So what's the smallest geographical area for which we have data? So can you drill down to postcodes, villages, towns, etc.? And that is from Michael Southworth. And the third question that we've had is from a Christine Clegg, who was travelling on the number 1 bus on Sunday and observed people not wearing face masks and asking why this is allowed when it is mandatory. So those are the three questions that we've had. If I can now, first of all, go to Richard for an update on LRF activity and perhaps might just cover the bus issue as well. And Lisa, I think when we come to you, we'll come on to face coverings in general, if that's all right.
Okay, thanks, Julia. From an LRF point of view, given the fact that we are seeing a slow decrease, the virus is still stubbornly present, of course, but there is a slow decrease in prevalence. So what the LRF is going to do is just to wind back some of the machinery that it has in place. All the agencies are going to be stood ready, and we're going to be having weekly meetings still, but with a bit of the less of the formal apparatus that goes around that, which I think will be helpful for all of those key responders. So everybody is still there, stood by, ready to deal with issues. But I think, as Lincoln will describe in a moment, we are seeing that reduction in cases that's pretty important to us. We know that in the hospitals covering North Yorkshire, for example, there are 27 patients with COVID, which has represented a slow decline over the weeks that we've had. And I think we've had something in the region of 36 new positive tests in the last 2 weeks. Now, clearly, there will be other cases that maybe haven't gone to test in the county, so we've got to make sure that we keep that level of awareness going. But all of that points to that steady and slow, if not something that's a stubborn decline, Julia, in terms of prevalence. If I can just talk for a moment from one of the county council issues at the moment, which is around care homes, and then I'll address the bus issue. We've been clearly very anxious about the situation in care homes and working very hard to provide as much support as we can to them. There have been issues in North Yorkshire, as there have been in all parts of the country around this. But again, we are seeing quite a decline in the number of care homes with active cases. So we have 7 care homes where there is a present COVID case, or there's been a COVID case within the last 14 days. And again, that is a pretty good improvement on where we've been at the height of this pandemic, when we were in the sort of 60-70 territory at some stages. So that has come down well. We continue not to be complacent around that. These are highly vulnerable people, and we've got to, people who are in the care sector looking after these care homes are doing a great job, and we've got to stand alongside them and make sure that we all keep up this work together. So that's probably the general remarks I'd make, Julia. And then if I address your particular question around the bus travel, clearly the County Council helps to subsidise a number of bus routes across the county. Many of them, though, are commercially funded because there's enough passengers to enable them to operate in that way. And in terms of the legislation that requires people to have a face covering when they're on transport, that applies to buses as it does to trains and the tube, which has probably been much more high profile when you see the Prime Minister's press briefings and all the rest of it. So it absolutely is covered by that. When people get on a bus, they should wear a face covering. And we would frankly expect and hope that bus drivers would make that clear to passengers who are coming on there, remind them of that obligation. And I think there is something for us all now as we move into this next phase where we're going to even be expected to wear face covering in shops towards the end of next week, that there is something about personal responsibility here. When you are going into an enclosed space, you must wear face coverings. That is the way that this is going across the country, and public transport and buses are the same. At the end of the day, there is a legal sanction to be enforced by the police, but I don't think any of us want to get there, probably least of all the Chief Constable, in terms of having to pick up that responsibility. We would rather the bus companies reminded people and people carried out their civic obligation to look after the safety of other people on the bus.
Thanks, Richard. Can I just ask, have there been any more plans around how you would deal with local outbreaks?
We are, I mean, Lincoln, I'm sure will add a bit more colour to this. Lincoln is the guy in charge of this area, but we've had a number of local outbreaks on small scales, some slightly larger scales, not of the really big scales that you've been seeing in other parts of the country, but nevertheless they are happening across North Yorkshire. And we've adapted a way of working with our public health team, working alongside colleagues such as environmental health officers and specialists from whatever sector the issue may arise in. So we are now getting pretty adept at working with the different settings where these cases can arise, identifying who the individuals are, making sure that people get tested in that general environment, finding out the positive cases, requiring those people with positive cases to be self-isolated until they get themselves tested negatively. And so that is coming together, Julia. We've got our outbreak board, which is the public-facing vision of that, which enables us to have some political steerage and political involvement in how we're looking at those issues. And Lincoln, again, helps to provide that board with updates and information. So the approach is developing all the time, but we are unfortunately facing some of these outbreaks. So I think we are picking up a rhythm and a way of working in that regard.
So I suppose I'm just sort of thinking about what might encourage people to wear face masks. And certainly when you talk to people, I think people very often say, oh, well, there's not much of the virus around here. Why should I do this? And information about some of the sort of local outbreaks might just exemplify the need to wear face masks. I don't know what your view might be on that.
Yes, I agree with you. Yeah, and so the number of cases are small, but the cases are there, and that is only the reported cases where we've got positive tests. There will be other instances of the virus being active in our county. And what we know from other research, and again, Lincoln may want to comment on this, is that there's more and more evidence that if you're in an enclosed space, then you are at risk. And I think this is where the government's policy is going, whether that be public transport or in shops, that in those spaces you need to protect others. And if we're all wearing face masks, then we're all protected in that regard in terms of coughs and splutters that may happen. And that's what we've got to do. And we've got to just think, why not? Why on earth not? We are in a time like there has been no other time before, and to look after our fellow citizens in North Yorkshire, take care of their health, and to think about those vulnerable people. Why, for heaven's sake, can't we just wear face masks in these settings?
Thank you, Richard. Lincoln, do you want to come in on any of this, and also just to talk a little bit about the test and trace in a bit, perhaps in a bit more detail, how it works, what people should do?
Yes, happy to do that. So just to echo what Richard was saying, the virus hasn't changed in its behavior. It still transmits in the same way that it transmitted back in January. And it's important that people recognize that although the numbers have fallen, the potential always exists that it could take hold. If we miss a cluster of cases, it probably could take us about a week, and then you have quite a little bit of an outbreak going on your hands. So you could go from not being in the league table, and in a couple of weeks you could shoot to the top of it. And we need to recognize that's the potential, which is why surveillance is so important. I'll talk a little bit about one of the questions about what data do we have. So Richard mentioned that the numbers that are coming through in terms of people who are tested and coming through the test and trace statistics, coming through the nationally available data. So every day the national data is updated on numbers of new cases, and that's recorded at a district level, upper tier, so you can see for North Yorkshire as a whole, for each of our districts and boroughs, as well as nationally. That information says that in North Yorkshire, about the last 7 days, which is one of the key metrics we're looking at, we're averaging about 1, possibly 2 per day. So that's really low, and that's affecting all parts of the county, obviously. Some of the other things that we look at, we do get some information. This is not in the public domain, but we get information on test positivity. So we have in North Yorkshire, we've done a lot of work with the LRF, with colleagues, with the military and so forth. We have a number of testing routes to make sure that access to testing is as easy for residents as possible, and particularly around managing the care homes outbreaks. We can monitor the rate of positivity of those tests, and if that begins to rise, that's an early warning that we might be seeing an increase in cases. And one of the responses there would be to increase the access to testing in those areas to see what's going on. And then there are a number of other bits of work that Public Health England has available in terms of looking at the numbers and predicting whether that's an increase over what you would expect in a given time period in that geography. So we have a number of things that will give me, Public Health England, early warning to look in more detail if we're seeing anything developing in an area. Clearly, a lot of that data is derived from stuff that people give to test and trace, for example, confidentially. So we would never publicly or give public access to data down to a postcode level. That is held very, very securely. But should we need to investigate in more detail what's going on in a particular outbreak or in a particular cluster, we have that ability working with Public Health England to drill down to those kinds of levels. Some people ask about the R value, and there is a tendency of trying to find one number that tells you everything. Unfortunately, that does not exist. The R value is a useful summary. It works best kind of at a regional level, but when numbers begin to get very small, the R value begins to be very unpredictable. It can move around very quickly just due to random variation. So in North Yorkshire, you know, if we suddenly went from 1 case to 5, and if that were in a district, it could begin to ping off all kinds of stuff, and that could simply mean one person infects their household. Yeah. But given that it would be a 500% rise, it could begin to spark all kinds of interest. And I think it's important that you are very calm, you look at a situation, judge what's happening, and then take proportional action to deal with it. A bit on how we're operationalizing the plan. So those who are interested in these things, our cabinet endorsed the plan this morning. It is online. It's been online since the end of June, so people can see the outline, the principles there. Behind that is a lot of work, initially around identifying where are those settings, what groups of people might be at increased risk of contracting the virus and or getting more severe illness having become infected. So we identified clearly schools are an issue. Transport workers, you can imagine, would be a concern. The care home sector, we've had food processing factories, etc. And the idea there, the work that we're doing, is to identify and begin to proactively engage. We had an outbreak where a number of the workers did not have English as their first language, and that's an interesting approach about making sure all the test and trace literature is available. I was just on a national call. I think nationally they've now done resources in 15 languages, and that work will expand. So we take that work, we modify it for our local situation, and we find the many different routes to get that information to people in ways that make sense to them, put it that way. So that's a key role. And in terms of one of the questions, how can volunteers get involved? Well, I think that's an active place there. Volunteers are often close to their local communities. It's how do they continue to help us in terms of those proactive messages, in terms of modeling the good behavior, in terms of village halls and other venues. How do we make sure that volunteers help to make those venues safe? One of the interesting things is about when you're an event organizer, keeping a confidential record of the people who have attended and their contact details, because should something then happen, it's so much quicker for ourselves and Public Health England to contact an event organizer who can say, these are the people who are here, these are their contact details. It makes contact tracing immediately more simpler. And in North Yorkshire, where we are a tourist destination, people may visit us who live elsewhere. Being able to really rapidly say there is a focus here, these are the people involved, would be something I think the volunteers could meaningfully continue to do as part of the kinds of stuff that they do in their local communities. So I'll pause there for any follow-up.
So just on volunteers, I think that's quite interesting. I mean, we've done a little bit of work in my office around the impact of COVID on volunteers. And I suppose in any community, there's only so many people who actually want to volunteer. And we've seen obviously a big rise in volunteers coming forward and wanting to get involved in COVID. But on the other hand, it seems may possibly have drawn volunteers away from other activities. So we are seeing, for example, in some areas, reduced numbers of volunteers working in the charity sector, which might be impacting on the delivery of those charities. So I suppose I would just make a bit of a plea to people who are volunteering to not just sort of desert what they normally do for COVID, because what they normally do is really important, particularly when people are feeling vulnerable in their communities. And I think that's something that we collectively probably just need to keep a bit of an eye on in that impact. So we, for example, are concerned in the Scarborough area around this, and that it may have an impact on some of the charities that are operating in Scarborough Borough. So that's just something I think we all probably need to be aware of. People, what should people do if they think they've got symptoms? Where do they go, Lincoln? What do they do practically?
Yeah. So the first thing that you do if you have symptoms, and the classic triad is a fever, a new cough, new persistent cough, loss of sense of smell or taste. That's the kind of classic, but you may just be unwell. You may have, aches and pains and so forth. Some people may have, particularly elderly, may have more GI symptoms, nausea, vomiting kind of stuff. So essentially, if you're unwell, and remember that the thing about this virus is that you can transmit even before you develop symptoms, 2 to 3 days before. And a proportion of people, the percentages are still being debated, but probably 1 in 5 or more can actually transmit without ever developing any meaningful symptoms. So if you feel that you have symptoms of COVID, the first thing to do is to withdraw yourself from others. Organized testing. There are many testing routes. One of the easiest one is to register and get a postal swab kit through. The turnaround times for getting results back is improving dramatically. We've had situation, one of the outbreaks that we managed, we got back results within certainly 24, 48 hours. We had the results of those tests, so that's quite positive. And then if you have a positive result, that will trigger the test and trace system, and you will be contacted by one of their contact tracers, who will then ask you about your activities, where you've been, the contacts that you've had, and then those contacts will be followed up, advised to remain isolated for 14 days. If they become symptomatic, to be tested, and the process continues. If you are symptomatic, you will typically isolate for 7 days. If you're still symptomatic at 7 days, you continue for at least 48 hours clear of symptoms before you begin to contact other people. So that's broadly the process that people need to follow. So as soon as you're symptomatic, begin self-isolation, get tested, get the details of your contacts so that they can then self-isolate as well.
Okay, so the government now is sort of really trying to sort of encourage people back to work as well. And I suppose where should you go if you're going back to work and you don't think your employer is doing what they need to do to keep you safe? Where'd you go? Who do you talk to?
So there's lots of information, and one of the things that we're doing is to make sure that we signpost better. So one of the things that we're doing in settings and in some of those groupings is to make sure that people are signposted to what's available in terms of support. The other thing, and again, a role potentially for volunteers, about what is the practical support for people. Say you're a single person or you're an older person or whatever, you need shopping done and that kind of stuff. We're still using these community support organizations, that infrastructure that we use for the shielded populations. That is an infrastructure we will be using to help people in this situation. So I would say a first port of call might be to get through to the county council, to the community support organizations, and then they would be able to signpost people from there. But we're trying to proactively link people into those information sources so that they can do the right thing, quite frankly.
I suppose because, I mean, from a policing point of view, when people are worried, they tend to just phone the police. And so there's crime is sort of going back to its normal levels now that lockdown has finished. And so the police are a lot busier than they were before. And so what we are concerned about, obviously, is lots of people calling the force control room, and that sort of clogging up the system. And so I think it would be really helpful if if they are worried about the way that, they're a situation, that perhaps collectively we need to find a way to deal with those concerns.
Yes, and I agree with that, certainly. I mean, one of the last things I want to say, unfortunately I have to leave for another meeting, is I think people have to begin thinking contacts. And what I've been saying is, if you're going to have difficulty identifying your contacts to somebody, you really should rethink that activity. So if you're going to go out in, and you're going to be at a mass gathering and you can't, work out, these are the people I've been in contact with, particularly face to face over a period of time, that for me is a trigger to begin thinking, is this really an activity I need to do? If it's not, I mean, going to the shop and supermarkets, that's a different thing, but there are lots of systems in place to keep you safe. And I think there are lots of typical, I don't want to pick on any particular group, but just in my going out and about, the groups that I see congregating together are young people and adults. And you kind of just think together, yeah, that's fine for you. You probably won't get major illness if you play the lottery kind of stuff. Yes, the virus can affect young people. We do have, unfortunately, small numbers of deaths in apparently, healthy young people. But the lottery is you probably will get away. The virus, however, can follow you home. Yeah, and when we are thinking about reopening access to friends and families into care homes, there's a deep worry, a lot of us who've been through that journey the last few months, that unfortunately it can track those kinds of activities and get a foothold into some very vulnerable populations. So that's the kind of thing. It's being responsible. I mean, you might get away, but we live together, and our actions do affect other people.
And so, Lincoln, I know you have to go, so this is my last question, but when will people be able to go and visit care homes? I've got a relative in a care home. She's very frail, and what she needs is her family, because that's what supports her and makes her feel more confident and better. And sometimes the downside of not seeing your family is almost as bad as other consequences. So I think people are desperate to see their loved ones in care homes.
Indeed, and we're working very flat out to put guidance in place, both working with the care homes themselves about how do we do that safely. We expect, I'm not aware that a date has been announced around that, but we're looking for that to happen sooner rather than later.
Okay, thank you. And so, Richard, I think you have to go as well, don't you? Is there anything else that you'd like to sort of add or comment, and then you can scoot off to your next appointment?
Just to reinforce that message, Julian, that many people have done really well to help the county get to what is at the moment an encouraging position, but we've got to stay with this in order to make sure that we don't let a good position go. And what Lincoln said about, this can be quite fragile still. So by all means, we need to support local businesses, support our local pubs, but do so in a really safe way. Try and be outdoors if possible. Think about face coverings, think about our proximity to other people and the basic hygiene methods that we've been talking about before. So if we keep that vigilance going, then hopefully we'll maintain what is an increasingly encouraging position.
Okay, and any sign of a vaccine?
It will come. The key thing, Julia, is let's promote flu vaccination, because that's the dry run. Yeah. So even if it comes there, the logistics about how do you roll it out quickly, and I think we can really prove to ourselves that we can by lots of people coming forward for the flu vaccine. That will be the dry run. Okay,
so that's great. Okay. So get your flu jab this winter, everybody.
Indeed.
Okay, thank you. Thank you both. I do appreciate it. It is really, really, thank you. Thank you very much.
Thank you. Bye-bye.
Okay, so we're now on to the sort of policing side of things, and we've got some potential announcements that are being well trailed in the media about shops and all of the rest of it. So Mike, is there anything else from a sort of SCG point of view that you want to add, and then we'll come on to the new stuff?
No, it's just to I think Richard mentioned it, but we have started to collapse down some of the meeting structures that we have within the Strategic Coordination Group, which is obviously the multi-agency response to this, which I'm the SCG chair of. However, it's very much in hibernation mode. We're still dealing with an emergency situation, but many of the agencies are going away now and starting to implement some of the recovery plans to try and get back to some form of new normality, whether that's around the economy or various other factors, including the police getting back to some form of new normality. There is still multi-agency meetings ongoing. We will still be working collectively together. We see obviously there's a potential of a further spike in the winter, and we're absolutely conscious of that, and therefore we will keep those working relationships going to maintain the good work that the public have largely done a fantastic job of reducing the spread of the virus. But again, just to reiterate what Richard said, the virus is still amongst us. We are still seeing numbers within the county. We're still seeing clearly numbers nationally. There's over close to 50,000 people who have unfortunately lost their lives nationally due to COVID, and we must not forget that. The daily briefings have stopped from a government point of view, but it still needs to be at the forefront of everybody's mind. Clearly today, and we're expecting further announcements in terms of face coverings in retail premises, and we as the police need to adapt to that, but more importantly, the public need to adapt to that, and the public need to get ready. You see lots of people wearing face coverings already in retail premises, but what I would say is that, you know, we've I think it's around the 24th of July, and people have 10 days or so to get ready, to get face coverings, to make face coverings. If you go on the gov.uk website, there's a guide to making your own face covering. So it's about being prepared, and it's about looking ahead, but also having, you know, one eye on the fact that the virus is still here as well.
Okay, so thank you very much. So can I just then ask around the sort of, I mean, obviously North Yorkshire has issued an awful lot of tickets in comparison, say, to Kent, which didn't issue very many at all. But how are we going to deal with some of these new laws that are coming in around mandation of things like face coverings?
Okay, well, again, we're still waiting for the official guidance and steer from our colleagues at the National Police Chiefs Council. We're very much working collectively nationally around policing, and then that information is disseminated regionally and then locally in terms of how police across England and Wales are actually going to police this in the same manner. So we're still waiting for that detail. However, we are already having discussions at our command level, myself as Gold and the Silver Commander, in terms of some of the actions that we may need to start to look at in terms of how we communicate with the public around what's expected of them, and importantly how we communicate with retail premises as well, to ensure that we all fully understand what each of us, the role each of us has in any potential new regulations around face coverings in retail premises. So clearly there's a lot of work required from our point of view over the next few days to ensure the public are going to be fully aware of North Yorkshire Police's approach to the new regulations. It's important to note that throughout what we've adopted is the 4E's approach, which is to engage with people, to explain the regulations, to encourage people if they are not adhering to the regulations, and then in certain circumstances to enforce the health protection regulations of 2020, which, as you've mentioned, North Yorkshire Police have issued more tickets, more fixed penalty notices than any other force in the country. And that's simply because North Yorkshire Police has taken our obligation to protect the public very, very seriously. I'd like to reiterate we will continue to do that. Yes, we are seeing demand go back to, in certain areas, pre-COVID levels, normal policing, as people would call it. But we're in a new normality. We are very much going back to dealing with normal policing in the middle of a global pandemic. So the officers over the last few months have got very used to understanding the regulations and very used to engaging with people, explaining, engaging, and then unfortunately on some occasions enforcing. And we will continue to do that for e-approach. But it is very much, and the vast majority of the public have understood it and have followed those regulations, but it is very much about social responsibility and the public doing the right thing, understanding what their obligations are and sticking to the COVID regulations.
Thanks. Lisa, we were talking earlier around some of the sort of legalities of all of this, which is quite interesting.
Absolutely, yes. And this is where Mike's saying we need to probably wait for, one, the legislation needs to be changed, because, of course, right now here today, it is not unlawful to go into a shop or a retail premises when you're not wearing a face covering or a face mask. So as we've seen as things have developed through the coronavirus period, as each of the new rules and guidance have been published, there has to be a piece of legislation that backs that up. So we've heard a little bit in the media today that it will be unlawful for you to go into a retail premises without a face covering, but that requires a change in legislation. So over the coming 10 days, that legislation will be looked at by people in a position who understand how the law needs to be implemented. And once that legislation has been looked at, we will then be issued with guidance as a law enforcement agency, as a service, to how that should be implemented. And so there will be some intricacies around the fact that if you are refused entry into a premises, you then become a trespasser and technically you are somewhere you shouldn't be. And at the moment, issuing of tickets is in a public place. So there's probably some work to do around that for the legislation to take that into account. And so we will wait to see what that guidance is and how the legislation is enacted, so that we can ensure that the right guidance goes out to our officers and staff. But absolutely reiterate the point that's been made. This is about social responsibility. We want people to keep themselves, their families, society safe from harm. We want people to be well. We don't want people to lose those who are close to them, their loved ones, through catching the COVID infection. And therefore, we should all take personal responsibility, and we want to engage, explain and encourage before we have to enforce as a last resort. But of course, we'll work very closely with our partners. You know, there are agencies that provide services out in communities, enforcement type roles in local authorities. Of course, retail sector employ their own security staff. So we want to work together in partnership to keep people safe when they're out and about. And as we've heard from Dr. Sargent in his medical expertise, in his Director of Public Health role, this is about keeping people free from the infection. So we would urge people is do the right thing for yourself, for your family and your community in the first instance.
Yeah. OK. Well, we all hear that. I think that's really important. I think it's difficult, isn't it, when sometimes you sort of hear people saying, oh, well, we don't have much of it around here, and people thinking, well, why should I do that, and all of the rest of it. And I think we're just all going to have to get used to doing it in these strange times that we are living through. I mean, there were at the beginning of the pandemic, you know, some incidences in other police force areas of, you know, policing people's shopping and that sort of stuff. And I worry a little bit that we're sort of straying back into that sort of territory with this. And I suppose, you know, it's how your officers, you know, take a sort of proportionate approach to all of this.
Absolutely, yes. And our officers and staff have done an amazing job alongside some great volunteers that have worked alongside us to help during this period. And I can't thank them all enough for their resilience. We've had very low absence rates. People have been really keen to come in and be part of the national effort to keep our communities safe. So there's a huge thank you to our staff officers and volunteers and all of our partners that work alongside us in doing that. But of course, as you've said, Commissioner, they take their jobs very seriously. So when the legislation was first issued, and we are a law enforcement agency, people took their job very seriously in enforcing that law to keep people safe, because we just want to keep our communities safe. But we've learned, as you've said, there have been several examples where, quite rightly, this is enforcement as a last resort. We want to work with our communities. We police by consent. We are very fortunate here in North Yorkshire and the City of York that we have a great relationship with our communities, and we can only keep people safe in our communities and deliver that service if we work together with that community. So we'd much rather advise people if they are ill-informed about what the requirements are before we have to issue any enforcement. And I'm hoping that this piece of legislation is issued in the same way, that it's absolutely an advisory thing where people will be polite and courteous when they're asked to put a face mask on or a face covering, and that we only have to go as the police service in really extreme circumstances where the public need us to react to something where people absolutely don't want to support the health and well-being of the rest of society.
Yeah, so if there was some altercation or something like that, presumably, which, you do worry for people working on sort of, transport and in retail sectors that workers might get, aggressive behaviour and all of that sort of stuff. So that I suppose is a bit of a risk. Okay. Does anybody else who's on this got any more questions? I don't think so. So I think that's probably it. I'd just like to say thank you to you, Lisa and Mike, but also to Lincoln and Richard. But also just to make a note that, of course, as PFCC and North Yorkshire Police, we cover North Yorkshire and York. Asked us Richard in his chair as chair of the local resilience forum, but next week we will be, I think, or the next meeting anyway, we will be getting a public health director from York onto this call, so we can get their perspective as well. So I think that will be helpful. So thank you very much, everybody, and hope you have a good rest of the day. Thank you.
Thank you.